Hello, welcome back to my YouTube channel. So today I'll be talking about something very important. Have you ever noticed your two legs swelling up? Maybe when you wake up in the morning, you will look at your legs and they are swelling up. Or towards the night, you will look at your legs and they are swelling up. It might seem harmless at first, but it could be your body way of signaling something important. The truth is that swollen legs are not always about standing for too long, sitting for too long, staying in a place for too long, being pregnant. There are other things that are linked to swollen legs. And today I'm going to be exploring those things. Then I'm going to be telling you what to do when you notice your legs are swelling up. The first thing that can make your leg to swell up can be kidney diseases. Kidney is one organ in the body that plays a vital role. The role of kidney in the body can never be overemphasized. In fact, working as a doctor in a diagnostic center, people are so afraid of having a kidney failure, and I understand, because once your kidney fails, you would be on dialysis for a long time until you eventually have money for a kidney transplant. That's why it's very important to pay attention to some of these important clinical presentations. Another thing that can cause your leg to swell up can be heart conditions like heart failure. Another thing that can cause your leg to swell up can be deep vein thrombosis. Okay, when the vein are insufficient, when there is poor venous drainage in the lower limb, you see that both limbs will start swelling up, and most times you notice that one leg is bigger than the other one, or the swelling is just on one leg and not on the other one. Most times we suspect deep vein thrombosis. Another thing that can cause your leg to swell up can be liver problem. Okay, it can cause your leg to swell up. Also immobility and other things, pregnancy, those ones can also cause your leg to swell up. So how would you differentiate swelling from kidney, from that of the heart, and from that of the liver? You check the timing. Okay, most times I ask my patients, so when do you notice this swelling more? Is it in the morning, is it in the night, or is it like this morning, afternoon, night? Some of my patients will tell me, well, at night it's okay, but in the morning it's now much. With the history, I'm looking at the kidney pattern is more in the morning. Some of my patients will tell me, well, in the morning I will notice that it will reduce, but towards the day, at night approaches, I will notice that it's increasing. I will know that this one is linking me to the heart. Okay, and then some will be like, doc, to be honest with you, this thing is the same morning, afternoon, night as it was in the beginning, is now, and it's like that forever. I will know it's liver. And then I will now go on to ask some specific questions that will help me to make my diagnosis, and then I will send my patient to some investigation. The first point is to meet a doctor and explain this to the doctor. Then the doctor will send you to do some investigation that will help in his or her diagnosis. So for me, if I'm thinking that this might be a kidney problem, I will send you for an ultrasound scan, and then I will send you to do a kidney function test. I also send patients to do urinalysis to check for some specific components in the urine, like blood, like protein. Okay, I'm checking out something in the urine to help my diagnosis. If I'm thinking, okay, this might be heart issue, I might ask you a chest x-ray or an ECG or an echo. There's also what we call BNP and some other investigations that your doctor would want you to do so that he can pin down his diagnosis. If it's liver, the doctor will send you to do liver function test, abdominal scan to check the liver. Okay, then you can also be asked to do a fasting lipid profile to check your cholesterol level, and also some other investigations for to help in management can be food count, total albumin, urinalysis, and so many baseline investigations to help in the management. So if you've noticed that your leg is swelling up, don't keep it to yourself. Don't die quietly. Don't neglect the signs your body is giving to you. The good news is that here in the city of Oka, Anambra State, we have a unique diagnostic center called Clinics Healthcare. Here in clinics, you can run all these tests, not just the investigation. You are also privileged to talk to a doctor. You will not just go there and be doing anything you want. When you get there, you would meet a doctor. The doctor will examine some history and send you to do the right test, so you don't go spending all the whole money and then you ended up not even knowing what is wrong with you. So Clinics Healthcare is one place you need to be this 2025 so that you get your body checked up. So don't die alone. Open up and let's help you. I'm Dr. Mige. See you next time. Bye.